Hi guys, it's Sarah Chernick again. Today we're doing chapter 5, pages 106 to 110. The chapter begins by talking about how drugs affect the brain. So the first section is called a little chemistry. The chemistry of a drug molecule determines how quickly the body responds to it. And this includes liquid solubility. So this is the extent to which a chemical can be dissolved in oils and fats. And this determines, again, how quickly the drug itself will dissolve into the bloodstream. And then the 4 routes of transmission that are spoken about in the book include oral, insufflation, injection, and inhalation. So most psychoactive drugs are taken in these 4 routes. The first one's orally. So this is the simplest way to take it, but it's also the most complex way for it to enter the bloodstream. And the reason for this is because the chemical or drug must be able to withstand the stomach acid and the digestive enzymes. And also, if there's food in the stomach, it's going to cause a slower absorption rate. The drug must also be water soluble for it to dissolve orally. So only liquid soluble and small water soluble molecules can be absorbed into the capillaries around the small intestines. And this is the reason why the drug must be water soluble. Less drug goes into circulation if it is rapidly metabolized. Okay, and then the next way in which you can administer a drug is insufflation, which is inhalation through the nose. This would be, for example, like snorting cocaine. So this involves the mucous membranes, and since they have a rich supply of blood vessels, it allows for the drug to enter the bloodstream. This also allows for it to bypass the liver, causing a faster onset of the drug. And there's also a risk for nasal necrosis if there's a constant or regular use of insufflation. All right, the third way of administration is injection. This is when the drug is put directly into the bloodstream using a needle. There's a rapid onset. There are a couple benefits. So one of them was that the irritating material can be injected without causing a bad reaction. And then you can also deliver high concentrations of the drug. Drawbacks include how the vein walls will lose strength and elasticity, how many small injections in one place can cause the wall of the vein to collapse, and how there's an increased risk of introducing infection into the bloodstream through the use of needles. Okay, so the subcutaneous versus intramuscular injections. There's a more rapid absorption when the injection is intramuscular. And the reason for this is because muscles have a better blood supply. And then the absorption is most rapid in the deltoid muscle and slowest in the buttocks. There's a less chance of irritation during intramuscular injection because there's better blood supply and faster absorption. And extremely irritating material can cause skin around the injection site to die and shed. This is called skin popping. The final part of the book just talked about inhalation, which is inhaling drugs through your mouth. This is done when people use marijuana or crack or cigarettes. There's a quick onset of the drug, and there are 3 considerations that must be had. So first, the material can't be irritating to the mucous membranes. It's also hard to control the dosage, and the drug must be continuously given in order to continue to have an effect. So it wears off pretty quickly. Okay, this was a pretty short one. Thank you for listening. I hope this helps a little bit, and I hope you guys had a good weekend. All right, bye.